Welcome back to Breakfast Television. Migraine headaches are common and often disabling, and children, yes, children can get them too. Pediatrician Dr. Sarah Hall is here now with what parents can do to help. Good morning to you.
Good morning.
Thank you so much for being here.
Oh, thanks for having me.
I think a lot of people are still surprised by this, that yes, children can get migraine headaches.
Yeah, parents are often surprised when I tell them that their kid has a migraine. Migraines look a little different in kids than they do in adults, so it can be a bit tricky to diagnose.
Sure. So what does it look like in children?
So migraines in a kid can be described as that like bilateral headache, pulsatile, worse with physical activity, and associated with nausea and vomiting. Those kids are the kids that end up going into their room, into a dark corner until their headache subsides. And that's because light and sound can be really aggravating for their headache.
Oh, wow.
There's two types. There's a migraine with an aura and a migraine without an aura. And actually, if they have the aura, it's a lot easier to diagnose. So an aura is like a reversible symptom that comes just as the headache's coming on or at the beginning of the headache. So things like flashing lights or moving lines or blurry vision. The migraines without an aura, though, are a pattern of headache that we have to basically look at how it's kind of playing out, like how often it happens and what triggers, and that helps us with the diagnosis.
Okay, so it is really critical to get that diagnosis, which can lead you to treatment. But I guess that must be somewhat confusing because children get migraines, but they also get other kinds of headaches as well.
Exactly.
Can you outline those for us?
Yeah, another really common type of headache, the most common type of headache, would be a tension type of headache, which is that frontal headache that kids get when they're tired at the end of the day. Not usually associated with many other symptoms, but gets better when they rest.
Oh, okay. All right. So that's the most common headache that you see in children.
That would be the most common.
Okay. Terrific. Okay, so let's say you've got the diagnosis now. What can you do for these kids?
So the most important thing with migraines is to figure out a way to identify the triggers and to avoid them.
Oh, okay. So avoid them in the first place.
Yeah, exactly. Like fatigue and stress and not eating enough and not drinking enough. Those are the most common triggers. But even things like Calgary weather.
Right.
Chinooks can be a real problem for people with migraines. Right. Certain dietary things, caffeine intake. And caffeine's everywhere. It's hidden in lots of places.
Right. So kids who aren't necessarily having a cup of coffee, but they'll get it, say, in chocolate or something.
Yeah, or even in vitamins or energy drinks. Like it can be everywhere.
Okay.
So keeping a log of your headaches or your kids' headaches, when it happens, what time of day, anything that they had that might have led to the headache, that little headache log can really help us figure out what they've got and how to treat it.
Okay, terrific. What about pain medications? What happens there?
So the key with treating migraines is actually to hit it hard and fast. So just acetaminophen or Tylenol and ibuprofen, which is like Advil or Motrin, that can be really effective if you get it right at the beginning. So right at the first sign of a symptom, getting a medication into them. These medications are really good at preventing pain, but not so good at getting rid of it. So if you're on top of it, and teach your kid how to identify it, we can usually get on top of that pain.
Okay, so it's critical to hit it at that early stage.
We do have other medications if it doesn't work, and we have medications for preventing headaches if they happen to have like more than 3 or 4 a month and it just flattens them or they can't get things done.
Right.
So that's an option too if we need to, but just starting with those basic medications can be useful.
It's a great place to go. Okay. Very quickly, just tell us, you must get this question all the time. When should my kid get a CAT scan?
Oh, totally. Yeah. We get that question a lot, or an MRI.
Right.
Things that worry us, like red flags, would be really young age, just because they can't describe the symptoms to us.
Right.
Morning headaches, headaches that wake you up in the middle of the night, associated with funny symptoms like unsteadiness of gait or recent decline in activity level or how they do in school. So all those kind of things. If it's concerning to you, just let us know and we'll take a look.
And you'll take a look. Terrific. Dr. Hall, thank you so much again. Great advice as always.
Thanks for having us.
We're going to go for a break here on Breakfast Television. When we come back, we've got more news and weather and a traffic update for you. Stay with us. We'll be right back.